You're going to be meeting with our medical assistants prior to your surgery, and they're going to go over some of the preoperative medications that you're going to be taking. Arnica is one of them that we give you. You'll start taking this a couple days before the procedure, as instructed. In your care bag that you'll be given, you'll have purified water. We'll be giving you some Q-tips to help apply some of the ointment onto your eyelids. We'll show you how to do that. And some sterile gauze, okay? These are things that we'll be giving you. So once you have your procedure and you're headed home, whether you've received sedation or it's done in the office, the most important thing is to continue icing as much as you can and to make sure you're comfortable with pain control. Extra strength Tylenol works great, and icing on and off works incredible for pain control, bruising, and swelling. First day, we suggest you to use icing 20 minutes on and 20 minutes off while you're awake. Second day will be 20 minutes on, 40 minutes off. So you're tapering down. The third day will be 20 minutes of icing, 1 hour off. And so I'm going to show you how we like you to do ice compresses. There's a few different ways. Once again, we're giving you some gauze. So we have a lovely model here. And Jen, and when you're resting at home, we like you to be slightly with your head elevated. So you can be in your bed with a couple of pillows, you can be on your couch, certainly you can be at an angle that you're comfortable with. And I recommend icing while you're awake. When you're sleeping, just sleep in an angle that's like usually about two pillows of an elevation. We recommend you using Ziploc bags with ice. These are obviously big ice bags that we have here, but you can fill this up with ice or frozen vegetables. Like is one of these that you can put on like this, and you can have it rest there. If you have enough ice, it actually stays by itself. And you can throw the other one in the freezer and rotate. Again, try this, but I prefer this or frozen bag of vegetables. Like you can apply the whole bag and place it over. We'll do this for about 20 minutes on, you can rest, that's fine, and 20 minutes off. That's soothing and it helps with the recovery process. Now when you let go, you may notice a little bit of blood on the gauze. That's very normal, nothing to worry about. As long as you can open and close your eyes, that's great. The surgery will not create your eyes to be swollen shut, but it's normal to have some oozing, a little bit of red color tears, bloody color tears, super normal, okay? So that's the icing procedure. Then twice a day, we'll recommend you to apply erythromycin ointment. It's an antibiotic ointment if you're having upper eyelid surgery. And generally the way we do this is I'll show you if you come up here, the application of the ointment. You'll have your caregiver. I don't want you doing this on your own the first day because it's difficult for you to see and you may be a little sedated. But generally speaking, you'll apply this much per eyelid. If you need to put a little more, you can, but you shouldn't need more than that. It's a small amount. And you'll gently apply it along the upper eyelid, and very carefully with the Q-tip, you'll apply it like this, morning and at night. And you'll do it for both eyes. And then, if you also need to put eye drops in the eye, if you're having lower eyelid surgery, we'll give you some steroid with antibiotics in them. If you're having upper and lower eyelid surgery, we often just give you artificial tears. And this helps lubricate your eyes. So regardless, artificial tears will help your eye heal if they're dry, if they're teary. And what we do is generally have you look up and gently, your caregiver can use their finger with a glove or just finger by itself as long as it's washed, and place a drop in the eye and close your eye. And it's normal if it stings a little bit. That's super normal. And you'll do that with the medicated drop 4 times a day. And this artificial tears is an additional drop that you can use however many times you need. It'll clear your symptoms, and there's no maximum amount that you can use. You won't overdose on that, don't worry. And computer use, just try to give your eyes a break for the first week. We recommend you not using the TV, your cell phone, or computer for no more than 10 minutes per hour. TV's better because it's further away, but anything up close, your eyes can dry out. So just use your knowledge and judgment. Don't do more than 10 minutes per hour for the first week. Slowly increase as need be. If you have any questions, let our office know. But if your eyes feel tired and strained, take a break. That means you're using them too much, okay? We talked about the ointment that you put on twice a day. If there's some crusting around the stitches or the eyes, you can use the Q-tips very carefully and use the Q-tips to kind of clean off any crusting that you may have here or any crusting that you may have here. It's okay to use the Q-tip to clean off very gently. Now, the first 2 days after the surgery, I don't want you showering. You're able to bathe. You can bathe the first 2 days. So if your surgery's on a Monday, you can bathe Monday and Tuesday in ice like we talked about. Your face you can clean with purified water. I don't want you touching your face with tap water for the first 2 days. On day 3, if your surgery is on a Monday, which would be a Wednesday, on Wednesday to day 3 after your surgery, I want you to shower with shampoo, gently clean off your hair. If you've had a brow lift, same thing. If you've had upper lid surgery and or lower eyelid surgery, rule applies for everybody. On day 3, I want you to use shampoo, carefully clean your hair, and let the water rinse while you're in the shower. It's totally fine at that time, because by day 3, the scab has started to form and the wounds are not open. And that's why it's okay to use tap water, okay? So that's showering. And physical activity, basic rule: no heavy lifting, strenuous activity, straining, bending over. That requires you to strain or sweat for 2 weeks. I'll see you a week out to remove your sutures. As long as you're healing well, a week later you can resume full activities. A lot of my patients have a job, of course, and so I recommend you can go back to work usually about a week after the surgery. You may not look your best. You'll see me for suture removal, and then you can go back to work. If you wear contact lenses, I suggest you holding off 2 weeks prior to surgery and 2 to 3 weeks after the surgery. And if you need to adjust that, we'll see how you're healing. Maybe we can have you start using them a little bit earlier than 2 to 3 weeks. But generally, that's the right rule. Makeup, 2 weeks. If you need to put on makeup, 2 weeks is fine. Over the sutures, where the incisions were, no problem. And things to expect after surgery: it's okay to have some blurry vision after surgery. That is normal. You're going to be able to watch some TV, but in terms of reading fine print, you may not be able to do that for the first week or 2. That's normal. You may have some bruising and swelling. That's normal. One eye may be more bruised than the other. Remember, your eyelids are like siblings. They're not twins. So one eyelid may end up bruising more, the other may be swelling more. Just know that everything looked great at the end. I obviously do not finish a surgery until I'm completely satisfied. So we'll just know that most of that bruising and swelling will get better after 2 weeks. You may still have a little bit that lingers on afterward, but generally you're presentable for wedding, dinner dates approximately 2 weeks after the procedure, which is great. Things that our medical assistant staff will be telling you is, starting 2 weeks before the surgery, hold off on using any aspirin products, any blood thinners. As long as you're on blood thinners, talk to your doctor, make sure it's okay. Fish oil, biotin, majority of supplements, hold off a couple of weeks before, please. No contact lenses, we talked about, for 3 weeks before. And alcohol, lay low on alcohol for 1 to 2 weeks before the surgery. I want you completely stopping. Exercise is okay. You can exercise until the day before the surgery, but it's just afterward, okay? And that's pretty much it. So good.